Then they pill it up in plastic and then they distribute it. It's very hard to detect.
You know, Dana, I mean, young children now going out to trick or treat. I mean, basically parents have a decision to make. You don't let your kids get that candy. It doesn't mean the person giving it out is intending to harm.
You throw away all the nerds and the sweet tarts.
All right, so that's Jesse Waters. The Five was using the good old drugs in your kids' candy scare tactic, I don't know, to drum up their viewers' anger. Before we dive further into this hysteria, we really wanna make it clear that fentanyl in the United States is a very big issue. However, the fear of fentanyl in candy, might not be as big of an issue as they're leading us on to believe. So the latest data suggests that the annual drug overdose deaths have jumped 44% from before the COVID-19 pandemic. There are about 76,000 deaths reported in the 12-month period ending in March 2020. The CDC's latest provisional data show that more than 109,000 people in the United States died of a drug overdose in the 12-month period ending March 2022. Synthetic opioids, including fentanyl, were involved in more than 2/3 of overdose deaths in the year ending March 2022. Deaths involving synthetic opioids increased by a staggering 80% over the past 2 years, CDC data shows. Fentanyl is now the #1 cause of death for Americans aged between 18 and 45. That being said, conservative media really isn't taking this issue seriously, and instead they're focusing on fentanyl Halloween candy. I don't know, because maybe that drives more views. I don't understand their intentions, but specifically the hosts are fretting about rainbow fentanyl, which just refers to brightly colored fentanyl or pills. So the US Drug Enforcement Administration, the DEA, released a warning in August advising the public of this alarming emerging trend of colorful fentanyl available across the United States. Since then, some colleges and universities are cautioning students about the presence and dangers of rainbow fentanyl, and the California Department of Public Health has alerted K-12 school administrators in the state about rainbow fentanyl being a new trend. But are young people really flocking to rainbow fentanyl because of the colors? CNN spoke to a doctor, Dr. Sam Wang, who's a pediatric toxicologist at a children's hospital in Aurora, Colorado. Here's what the doctor said. While Wang and his colleagues are aware of rainbow fentanyl warnings, he hasn't heard any patients or parents mention it. So it doesn't seem like a very big issue. Mariah Francis, who's a resource associate with the National Harm Reduction Coalition, spoke pretty bluntly when Rolling Stone asked her about fentanyl, saying, "The idea that because the pills are colorful means that the cartels must be trying to force fentanyl or ply children or their Halloween candy is markedly ridiculous. People just make creative colors, and honestly, there's no reason for it. It's been happening for the last 60 years. We saw it with MDMA. We see it on club drugs, and it's actually kind of embarrassing because the DEA is just really, really late to the party." I don't think there was a pun intended there. Francis adds that the idea that cartels want children to mistake their pills for candy is utterly divorced from reality, and instead points to the very nature of fentanyl production as driven by profits, something that doesn't mesh with children who usually lack disposable income. Yeah, the cartels aren't like, you know what, buy this and give it away for free. It's not a great business model. The DEA has stated that it found 15,000 rainbow fentanyl pills packaged in Nerds and Skittles boxes in Connecticut. But take the DEA's word for what you will, the rainbow fentanyl Halloween crisis, it's more than likely just Fox digging up an old story and trying to sensationalize it again. I wouldn't be too concerned about this if I was a parent. Fentanyl, of course, is a major problem, but not so much for Halloween candy. Here's a statement directly from the DEA. With Halloween right around the corner, law enforcement officials are urging parents to check their children's candy. The DEA Orlando District Office has issued a warning to the public about products that look identical to common snack foods and candy, but actually contain high levels of THC, the principal psychoactive ingredient in cannabis. Yes, people are giving away their edibles for free to children. Thank you, Orlando. Definitely the people at the DEA office in Orlando watch Fox News. I'm pretty confident in that. Waz, what are your thoughts on this?
I just want to say to the listeners out there, the last part of what that lady said in her statement is the most important part. Drug dealers sell drugs to make money. Maybe some of you guys in the audience have never known any drug dealers. I happen to have. In my past, I've known people who sold drugs. They all did it to make money, to buy sneakers, get cars, therefore get girls, be popular. That's why they did it. They didn't do it to get kids high. That's just for free. That's just not one of the things. And then if somebody in your neighborhood happens to be someone who sells drugs, and you might think to yourself, oh, they wanted to participate in trick or treat this year, and they somehow messed up their packages. No, I don't think a drug dealer would want to give away his mode of income and then kill a bunch of children, thereby attracting the attention of the DEA. It just seems like this isn't an actual thing or a problem, because most drug dealers like money and staying out of the way of the police.
You know what, I have to bring it up again because the last time Was and I were together, we were talking about another issue similar to this. The FDA was very upset about the trend of NyQuil chicken. No one's cooking chicken in NyQuil. Someone posted one TikTok as a joke. It wasn't even trending on TikTok. They made a huge deal about it. I would say you call that lean cuisine. I think that's a very good joke about the NyQuil chicken. But seriously, these people are so bored, right?
Yeah.
Like they're ignoring the real problems in our society. Maybe if you wanna solve the problem of fentanyl leading to overdoses, make Narcan more available, make that the focus. But instead, they just wanna cause hysteria among their boomer audience so that they have something to talk about in their Facebook posts. And also the police love talking about fentanyl. As we know, they're still claiming that they're overdosing on fentanyl just by touching it. Look at this tweet from Texas DPS. One of our troopers became ill after being exposed to a substance while conducting a vehicle search in Bexar County. EMS administered Narcan, and the trooper was transported to the hospital. Special agents were able to locate a substance in a container that tested positive for fentanyl. Then we have a doctor who decided to weigh in on this, and Ryan Marino said, "Hi, glad your trooper is okay, but it's not possible to OD on opioids, even potent ones like fentanyl and carfentanil, from being near them or even touching them. If those photos are supposed to help the story, maybe take the Vaseline off the lens, and Narcan is a brand, not an acronym." Really just debunking what the police are putting out there. So what did that officer do to end up overdosing? That's a question for the police department, not for me. But I'm sure we can imagine what went down there. I mean, come on.
God, yeah. Cops sometimes do drugs too, believe it or not. And I think more importantly, when we talk about the profit motive, the way that companies or agencies like the DEA, like certain, other drug war police involved agencies get funding for their efforts, get budgets opened for the things that they want to do, is to drum up this type of public hysteria. And so always be vigilant of the propaganda that's being spun by the people who directly profit from the drug war. Like there are the drug dealers who profit from drugs, but also the cops profit from the drug war as well.
Yeah, absolutely. I'm gonna share a personal anecdote here, which I don't do a lot, but I know someone in my family, my cousin who I grew up with, had used fentanyl for quite some time, since she was 12. And as of today, she's about 4 months clean. And the type of people who end up using these drugs are not like terrible people. They're usually like very happy people who have a really hard time dealing with how cruel the world is. She was like the kindest, sweetest, brightest person. And a lot of the times the people who end up getting hooked on these drugs are treating a pain they have inside of themselves. And we're really never gonna be able to fully address the extent of the opioid crisis unless we make the world a little bit of a better place for people to live.
Thanks for watching The Young Turks, really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR, so those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.